You're listening to the Sick and Good podcast. My name is Dustin Messick. I'm a registered dietitian nutritionist and a cancer survivor.
My name is Colin Goodwin. I'm a clinical psychologist and a cancer survivor. We're promoting wellness by having discussions on screening, treatment, and recovery throughout the cancer journey.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regimen. Dr. David Lee has been in full-time practice for 26 years. He earned his PhD in Oriental Medicine from American Liberty University. Since 2022, he has served as president of the Korean Acupuncture and Asian Medicine Association in Los Angeles. Through his own health challenges and years of clinical practice, Dr. Lee has developed an evolutionary medical system combining acupuncture, diet, and herbs. His work integrates traditional Oriental medicine with modern understandings of health, offering practical methods for personalized healing. Before we dive in, I want to briefly acknowledge that acupuncture has increasingly entered the conversation in evidence-based supportive oncology care. Multiple organizations, including American Society of Clinical Oncology, the Society for Integrative Oncology, and the National Comprehensive Cancer Network, now include acupuncture in guidelines for certain cancer-related symptoms such as pain, chemotherapy-induced nausea, aromatase inhibitor-related joint pain, neuropathy, and other supportive care concerns.
Welcome to the podcast. One thing we're increasingly seeing in integrative oncology research is that patients often report improvements across multiple symptoms at once. You know, if they're coming into acupuncture for pain or for improved sleep, fatigue, stress, and just overall being. Wanted to ask from your perspective, why do you think there are these interventions like acupuncture can sometimes just influence several aspects of that kind of range of symptoms?
Yes, simply put, acupuncture does many things because acupuncture taps into that person's ability to self-heal. The person's ability to self-heal is at many layers and many angles. Human body is the most complex thing in the universe because human brain is, they say, the most complex thing. Couple that with the body, even more complex. And the human body over time has been very good and in keeping itself intact, addressing issues when they come, timely and multitude at once. And that is the aspect acupuncture taps into. That's why people notice multiple improvements.
Dr. Lee, so many cancer patients describe feeling like their care can become very disease focused, while areas like stress, sleep, emotional well being, nervous system regulation, and overall quality of life can sometimes feel secondary during treatment. From your perspective, what role can acupuncture and Eastern medicine play in helping patients feel more supported as a whole person throughout the cancer journey?
Yes, there is a difference between biomolecular medicine and acupuncture. Biomolecular medicine is what you call physical medicine, and acupuncture will be what you call holistic natural medicine. And I could refer to the differences in both in this way. Biomolecular medicine is problem focused. If you don't know what problem you're dealing with, how are you going to treat it? Obviously. So you got to address the problem, identify it, and address the problem. That's one model in biomolecular medicine. And the other model is the person is in an extreme state. It's life or death. So then we have to save life. In order to save life, you're going to compromise a lot of things because it's going to require an extreme intervention. So two things, problem focused and an extreme intervention. That's the highlight of biomolecular medicine, the what you call physical medicine. And it's good. And we need to utilize that because there are not much natural medicine that's good at treating cancer. But natural medicine is good at promote healing. It's good at addressing multiple things that are occurring at once. I could give you an analogy like Lego pieces in a castle. Lego pieces are easy to measure. The weight, dimension, color, everything. So precise. Therefore, we know what we're dealing with. But let's say you put Lego pieces together and you get a castle, as an example. Well, how do you know what castle is exactly? There's no clear definition of a castle. Nobody has a definition that we could all agree on. So therefore, there is no exact shape of what that is. However, when we address the whole castle, then we get to address multiple parts in the castle. And like for example, one thing does not do one thing. One thing does many things. And we combine many things together to be even more many thing effective. Example is exercise. All right, then you get many benefits. You eat well, you get many benefits. That's clearer to us because that's our experience, and there's also science to that. But when it comes to some other natural medicine, how do you confine it in a test tube and measure it? You can't because there's no exact outer shape, and people have different views and different definitions of them. They exist. It just we can't measure, but we work with what is actually there, and we work with the pattern. That's why it works, and they work together because they're both working at different levels. One is problem focused, and the other is person
Yeah,
focused.
I was just thinking as you're talking about some of what you said about working with what's actually there. And it made me think of something you'd said in one of your other interviews on the podcast, Discovering the Wellness Formula, where you talked about the difference between objective and subjective science. Do you feel like that in some ways plays a part in related to the treatment of cancer patients within the Western and the Eastern lens of practice?
Natural medicine practitioners want objective science. They do in their heart and in their mind. It's just not practical. So therefore, we have to use what we got. Let's give an example. When a person experiences pain, is there a device that measures the amount of pain a person has? No such thing exists. But pain is the most common condition a patient sees doctor for. Then if you don't have exact objective science, how are you going to address it? We address it because they exist. And so then the natural medicine, acupuncture, works in a way that is comfortable with addressing subjectivity. We always question things to make sure we get things correct, and we should do that. However, in subjectivity, we could always question it, and the questioner will always be right. However, in subjectivity, there's two things about it. One is reflection of what's actually there, and the other is just making it up. How do you know which is which? You don't because you don't have objective of what measuring what that subjective experience is. But subjective experience is quite important. We call it gut feeling. Gut feeling is often correct. Gut feeling is often incorrect. What about the word well being? Does it exist or does it not exist? Is well being as important as physical pain and discomfort and dysfunction? Well being is our value. We pursue things in life because we have value to things. We have vision. We have these things that we have a purpose for. How are you going to measure those? You can't. But that's even higher than the physical experience because we use our body to get to the purpose in life and to accomplish them. That's why subjectivity is quite important.
One thing that we had talked about prior to recording here was just the systemic approach to acupuncture, and how there isn't necessarily a formula for then treating one symptom. Like if a patient comes in and says, well, I'm nauseous, then you're gonna be like, okay, well, my mind almost went to like Battleship, like, okay, well, it's B7, right? Like this is exactly where I'm gonna place the then pin or needle. What I wanted to then maybe ask here is like, how do you approach then those in active treatment? Say if this was that you are seeing them for the first time and they're in active treatment versus someone who might be, a patient who has a new diagnosis.
Okay, so those are multifaceted questions. I'll apply as in various ways as I can. Let me know if there's any gap that I missed out here, and I'll start. There are variables. Because there are variables, the treatments have to adopt, meaning there are different treatments for those different variables. As an example, even medications have different impact on the condition, because when we're problem focused, supposed to treat that problem, but people have different responses. People have different responses because people don't have one biology. Therefore, some people respond well, other people don't well, and they have to change the medication. It shows that there's, even in biomolecular medicine, there's no one way to treat. And because people have different biology, I could compare that to this. All roads lead to Mount Fuji. Mount Fuji is on an island called Japan. And there are different paths to get there. Some paths are more efficient, more straightforward. And some paths are more relevant to that patient, whether straightforward or less straightforward. It just more applies to that patient. Therefore, we have different methodologies. Why not a certain acupuncture point treat that condition? Well, it's known to treat it. That does not mean it's 100% better than random. Okay, but you wanted to have a high percentage rate of getting it right. At the same time, you don't want to have too many choices either. Okay, and through experiences, people have found different methodologies that work. But we don't know which methodology match up with that individual. And as time passes, certain methodologies win because they're time tested. Today, we still have too many methodologies. We could be seen as bad according to science because there are too many variables. But a lot of methodology means is that we have flexibility to find things that work for that individual. For me, I believe I have the methodology that has the highest rate of giving patients the benefit compared to any other acupuncture methodologies. And for the new patient, I use that methodology because getting it right for the patient has a high rate of correctness. And for the patients who come in later on for the same or different problem and the original treatment was helpful, when they come in with different problem, I still give them same acupuncture point because acupuncture is not problem focused. It's person focused. That's where we go off the rail. We tend to treat problems. Which problem is good with this acupuncture point and what other acupuncture point does it treat? And it's because we are problem focused. However, that is not the practical model to use. The practical model to use is find that acupuncture point that does everything for that individual, and come to find out that acupuncture point is genetically set in. It's relevant to that individual as a child, as an adult, and as an adult and as an elder. It's that simple. If we find that acupuncture point on that individual that does everything and is genetically set, then voila, we got it right at the beginning, then we'll get it right later on too, regardless of what
You know
problem
that
it
what that
is.
reminds me of is, as a dietitian, like, people will come to me and say, I have cardiovascular disease or I have diabetes, and there is, of course, more specific diets for those conditions, but there's a general eating pattern that if they follow, like a Mediterranean diet style eating more fruits and vegetables, half your plate vegetables, that it's going to help prevent multiple diseases at once. And I think I actually saw an acupuncturist where they're like, this point helps treat headaches. This point treats neck pain. This point, like, helps with blood flow. And they were actually an acupuncturist, but their initial area of expertise was chiropractic. So maybe they were coming from that like westernized viewpoint of point that works for specific condition. Have you heard of like different acupuncturists having that more problem focused approach with the different points?
Yeah, just as human beings are varied, we got different personalities, we got different knowledge, and we got certain level of ignorance, style, and so on and so on. And that means we don't have a standardization. We all have a different attempt to make things happen. Okay, so what lens are we going to use? And we have a variety of people, and so the profession does not represent, but the profession plus that individual's set of circumstances, where that person came from, what that person knows, how's that person educated, and so on and so on. That produces a lot of variables. And so somebody's truth is not somebody else's truth. Okay, and then about the diet, there's two things about the diet. There's general good way of eating. We have found out that low carb diet, Mediterranean style, and high protein seems to be good for majority or most people. Man, it took us decades to find that out. Why? Because food has many variables, causes many impacts. Not only that, it's subtle. Food does not give a direct impact. Well, sometimes, but there are many indirect impact on the body. So how do you measure those things clearly? It took decades to understand how food works. And we've been eating food for this long. And this is the amount of knowledge that we have. And how much more knowledge can we get out of understanding how food works in the future? Okay, so that's one aspect of food. And the other aspect of food is, just like medicine, individual varies. As an example, we know about top allergic intolerant foods: shellfish, nuts, dairy, gluten, eggs, fish, things like that. Okay, and there's more, but less frequent, but there are more. Most of the food are neutral, but some common foods that we consume are detriment for some people. If they're not detriment for some people, they're just compromising. And people don't know they're compromising because they're always eating food in combination. And it's not practical to eat one food at a time and see how they do. And that's where matching up with the genetic profile comes. I do body type diet. Constitutional medicine is body type. Constitution means it's something that you're born with and you're the same throughout your lifetime. If you're allergic to shellfish, nuts, gluten, just by that information, I could tell you, I could tell, and I could tell you what constitution you have because it's genetic. It's not changing. You could reduce it, but you cannot get out of being allergic, intolerant to those foods. And if you're going through chemotherapy and you have all these different problems, and you're allergic to, let's say, nuts and gluten and dairy, well, that's going to compromise you even more. Those are known to cause problems, but they're not causing just those problems. They're compromising the whole system directly and indirectly over time, strongly or subtly over time, it does compromise. So then if you're not good with those food ingredients, then you want to reduce them so that your body has better ability to rebound on its own. Don't put a roadblock in its ability to self-heal. That's why knowing your body type is important for correct
That's why
food
Dustin needs to
application.
stop eating Skittles.
We all have our vice. That's why I say none or one or the other is somewhere just becoming less so that you don't go over the threshold of being bad. So yes, enjoy your
Wanted to
Skittles
ask
just
if
a
you could
bit.
maybe take us through, a case study. I know that you provided us with some particular cases that you have seen. Wanted to see if you can just, like I said, walk us through those.
Okay. Well, then acupuncture treats a variety of different situations related to chemotherapy, radiotherapy, and we know about the common symptoms: neuropathy, pain, fatigue, nausea, vomiting, headache, and so on and so on. And people are at different places. However, acupuncture is relevant to them because acupuncture promotes healing. And so then it's measuring oneself against oneself over time. With 6 to 8 acupuncture treatments coming in twice a week, they see significant relief in all those symptoms, or at least majority of those symptoms, and they feel like they're doing better. And even when the chemotherapy does what it does, and after a few days, their body can recover faster with continuation of acupuncture. Yes, 6 to 8 treatments is enough to see how they do, and it'll be twice a week. And then it's less often than that, but it depends. If they're continuing to get chemotherapy, then they'll need to get acupuncture afterwards continuously. If they've already have had it done and they have residual symptoms, the body is not healing as quickly as it should. It's been 6 months after the whole treatment was done, or it could have been 3 years later and they still have neuropathy and ache and pain. Acupuncture will help them recover faster to a point where they're almost gone or they're all gone. I could give you as an example. A patient was on tamoxifen, which got rid of all the estrogen from her system, and she was taking that for 4 years. Normally, people take it for 5 years, and she had one more year left, and she was having raging hot flashes every night sweats every night, still quite severe. Even so, with 6 to 8 acupuncture treatments, got rid of 70% of those symptoms, and 6 to 8 more got rid of 90% more. So she thought, why didn't I get this started earlier? Well, later is better than none. Okay, so for that 1 year left, she had a pretty good minimal symptoms. So that's an example. And other example, I had a patient, he came in for prostate cancer. He was very natural oriented and he refused any type of treatment, chemotherapy or radiotherapy. And he had bleeding in his blood, he had frequent urination. Acupuncture and Chinese herbs reduced the frequent urination and bleeding. Did not treat the cancer, so eventually he got onto chemotherapy and radiotherapy. But helping the body does a lot for the patient. Another example is a patient had lymphodectomy, a mastectomy and lymphodectomy. And that can lead to edema in the whole torso, or edema in the legs, depending which of the lymphatic vessels were taken out and affected. Acupuncture does not help with the lymphedema, but the Chinese herbs do. Okay, even lymphedema that are lymphedema is considered not treatable. It's palliative treatments, but not treatable. Chinese herbs reverse the lymphedema by half, by 70%, or higher, even if they had it for 30, 40, or 50 years. That means that those who are prone to lymphedema and or not, and they had the mastectomy or lymphodectomy, and that caused lymphedema, that's very physical damage. It's a structural damage. However, it gets better. So what we think is not possible, it's not possible with this one method. But if you try another method, it can be possible.
One of the questions that I get a lot that I just wanted to put in here, because a lot of cancer patients I've talked to, I was like, well, have you done acupuncture? I hear it treats multiple things. And they say, oh, I'm afraid of it because don't they put needles in you? And that's going to really hurt. How's it going to treat my pain?
Yeah, there's a couple of replies to that. One is about the pain, and the other is not knowing about how acupuncture works. Okay. All right. About pain, acupuncture needles used to be quite thick and blunt. Now with the nanotechnology, they make it very thin and so sharp that you have to use an electron microscope to be able to see the tip of these acupuncture needles. These acupuncture needles are so thin that several of these needles go into the whole of a hypodermic needle. Okay, hypodermic needles are big. They go in and they tear. They hurt. And these acupuncture needles are just solid, and so they go in and they put flesh aside. So even being so sharp and thin, people do feel them, but it's a sharp temporary sensation. And it does not require an amplitude, which means shoving it in and twisting it and making it hurt. It doesn't require like that to make it work, because it's like turning on a switch. You're connecting a switch. You have the infrastructure, you have the wiring, you have the ballast, you got the bulb, everything is there, you got the power supply. You're just connecting. That's what acupuncture is doing through penetrating the skin. And so whether large or small, it doesn't matter. The efficacy is the same. So therefore, it's the minimal discomfort to make it
But
work.
electro acupuncture is like jumping a car.
Oh, that's a good
So maybe a silly way of putting it.
Yeah, right? Whatever is intuitive to us, we think that's the way it's going to work. But in practicality, we did not need electroacupuncture to make it work. We like to throw in electricity because, man, it just sounds so good and it's modern. Okay. So, yes, you could get pretty good result without electroacupuncture.
Yeah, actually, I gotta say, I did see an acupuncturist, a couple acupuncturists, and it was like they had put like 30 or 40 needles in me, and I couldn't even move. And that time I saw you, I was actually astonished that there was only 8 points, and I felt a much more profound experience afterwards than having 30 points put in my body.
Right. It's because acupuncture is not about lying on a bed of nails and rolling over on it. Yeah, I'm covering everything. Something's got to work. So that's not the way it works. The way it works is you got to hit the sweet spot.
You don't use the shotgun method, is what you're
And the
saying?
whole
You're just like, here, I'm going to just spray it, right?
right. Shotgun method or throw a porcupine. Porcupine. Throw a porcupine. Right. Yeah. Then we don't need to know how how acupuncture works. We just need to know the safety of it. Okay. And so yeah, it's just got to hit the sweet spot. And if you hit the sweet spot and also stimulate the non-relevant spot, it's not going to work, because the non-relevant spot is giving the body wrong information or confusing information and muddies the whole thing. Okay, so therefore it's better to hit a home run just with a really good whack with a very small thin needle on the right spot. Yeah. And so then that's what we're discovering over time. It's not the amplitude, it's not the number of needles, it's where you press the right button. Okay. And then about the acupuncture and recommendation of acupuncture by the medical professionals, I think one reason is because we have a lack of scientific data. And the other is that the concept of qi, yin and yang, is just like what is that? It's like, what is that? Get my chi flowing and my mojo going, or get my yin and yang balanced? Is that what it's about? There's some kind of statement about in Oriental medicine about getting the qi moving and the blood flowing, and that's negatively triggering the medical doctors. Does that mean the acupuncture is going to metastasize the cancer, spread things around? No, it's just a terminology. That's not the way acupuncture works. Acupuncture doesn't affect cancer. It affects the human body to self-heal. That's the level that it taps into. It doesn't affect the cancer. That's why we need a treatment that directly attacks the cancer.
So, as an acupuncturist, are you also an amazing dart player? That's a joke, I know.
I've been doing this for 26 years. In the first 3 years of my practice, I didn't make darts out of those acupuncture needles. With string at the end, put the glue so that it'll weigh, right? And then on the back of it with paper, tape it on as wing and just throw them. Show them to the patient. Hey, I'm doing dart, but it's too much of a joke. It's not. It's just not relevant to conveying the right message. But it's funny though. That's the first thing that I thought. Yeah, it hit the bullseye of the target, right? That's relevant.
That is targeted, right?
Yeah.
Wanted to see if you could tell us about your recent trip that you went on to Korea.
Oh, South Korea. Yeah, I went to South Korea to teach along with being with the family. Family was great. Really good time traveling, seeing, and eating all these different things that South Korea provides. Oh my gosh, variety and fresh. Loved it. And I'll go back again for more of those foods. And the climate and the mountains and the nature and all. And another reason that I went to South Korea for was to teach. I taught at two places. One place was in Seoul, in a area called Gangnam, Gangnam. You may know the song Gangnam Style, the horse-like dancing guy. He got the area being popular because it's a wealthy neighborhood. It's like St. Beverly Hills of Los Angeles. And I taught my method of acupuncture to 10 acupuncturists. And it was 2 hours long. 1 hour was the method, and the other hour was how to practice in the United States. The first hour, both the hours, I started off with Q&A. I gave my information in the first few minutes, and then I had people just ask questions, and I replied. It was good because everybody felt like they were conversing, and they were involved. And by the end of the hour, it was all smiles and all fun. And I was very honored to be able to present my data to the top practitioners in Seoul. And the other place was in Kyunghee University, Kyunghee University, which is the number one Oriental medicine university in Korea. I presented my data, my finding, to two professors who are in the top of the field. They regularly interact with the elites in acupuncture. They are the directors and they are the professors in the department, and they're also directors of the hospital. The conclusion was the data is impressive, but the interpretation that comes from the data just does not match with the current prevailing theories nor the original theories. The discussion was an hour and 15 minutes long. And yes, it was Q&A from the start because I didn't want to have the professor sit in and just listen to my words. So by the end of the hour, it was quite fun, interactive, and they summarized the presentation, they evaluated, and they gave recommendation of future things to do. They were very good professors, highly and very, very good. I really appreciated them giving me time to interact with them. But the conclusion was the data was impressive and cannot match up with the interpretation based on what we know. Okay. And I thought, well, we have to follow the data. Right? That's how we advance. And I was encouraged because before I went, that was the impression that I had, and it was a confirmation with their response. And those were my
And
Korea
can you just speak
experience.
to some maybe quantitative then improvements that you've seen in the course of treatment?
Yes. Although most of the time I get patients' feedback on what their experience outcome is, at times people do bring in their lab data. Lab data is the count of red blood cells and also the white blood cells and other numbers associated to them. They bring them after some amount of time they've been treated. And initially, they come in because they have a lot of discomfort, neuropathy, pain, nausea, all caused by chemotherapy, insomnia, and anxiety, of course. And so then, first chemotherapy is uncomfortable, and people usually get 6 courses of chemotherapy. Each treatment may differ, but generally people get 6 courses every 2 or 3 weeks. So the first chemo is uncomfortable. Second one is, much more uncomfortable. And the third one is unbearable. So they start coming for acupuncture after the second or third chemotherapy. Before each chemotherapy, it's a standard that the red blood cell count is done, just in case they need to get an infusion. You don't want the oxygen level to go down too low because red blood cell count indicates the oxygen level. And chemotherapy destroys anything that grows fast. That also includes the white blood cells too. And people get acupuncture twice a week. They feel better right away. All the symptoms are significantly better. And then they get chemotherapy. Oh my gosh, uncomfortable again. But after a few days, they get acupuncture and then they recover faster. And they're done with the 6 courses and they bring in their lab data. Shows that when they started acupuncture at twice a week, the red blood cell and white blood cell count has stabilized at the lower normal level. even without having to have infusion of red blood cell or taking medication to help the red blood cells to grow. And so then there were several people brought those in, and that was an objective indicator that the reason why their symptoms were not as bad, because their count had stabilized at the lower normal level. And so that will be, I think, evidence based. And perhaps using my methodology, it will be easier to scientifically see that this is relevant for people who are going through chemotherapy, because the red blood cells and white blood cell count gets stabilized. Not only
Dr.
the
Lee, in your
symptoms
book
go
by Some
less.
Acupuncture, two sets of 5 Horary points without a disease diagnosis, and the extended abstract published in 2018, you describe treating patients without relying on disease-based diagnoses, which is kind of related to our conversation that we've been having this whole interview. But I guess somebody who comes in who's a cancer patient might be expecting more of a diagnosis central approach. How do you apply practice with these patients, and what have you seen as like the strengths and limitations?
Yeah, you use the word bisoma and horary points. Those are technical words related to my field. But bisoma simply means bi, two. Soma means body. Bisoma, two bodies, indicating there are two sets of acupuncture points to use. Acupuncture points are what we call horary points, Horary points, and they are a certain type of acupuncture points. And the horary points, what they mean is they're related to 5 elements. In Eastern medicine, there's word qi, yin and yang, 5 elements. 5 elements are wood, fire, earth, metal, water. What's wood, fire, earth, metal, water? Just think of it as like 5 aspects of a person. So wood is one aspect, fire is another, earth is another, metal is another, and water is another. And there's a representative acupuncture point for each of those 5 elements. For the people who are not familiar with it, I could give this analogy. What if there's a one acupuncture point that treats all the skin issue? What if there's one acupuncture point that treats all the muscular issue, and one that treats all the endocrine, and one acupuncture point that treats all the nerve issues, and one acupuncture point that treats all the circulatory issues? That's easier for us to compare. It's like that. There are 5 points that treat all the 5 aspects of a person, and that's what we have discovered. Like I said, an acupuncture point treats everything, and we'll combine everything acupuncture points together to be more everything. Okay, and that's why we call it bisoma acupuncture, two-body acupuncture, because there are two sets of 5 points. If one set of 5 points work, then they will continue to work on that patient. If it doesn't, then we have another set that works for that patient. Holistically, multiple symptoms getting better. So it's like throwing a coin. You either get a head or a tail. You're not going to get a third option. So this is bisoma, two option acupuncture treatment. Because of that reason, we don't need a diagnosis. We don't need to know why you have these certain symptoms. Okay. What we need to know is what points work for that person. There's only 2 choices. We don't have multiple choices. That's why we don't need diagnosis. And when patients come in with questions like, oh, do you know what's going on exactly with me? Why am I experiencing this? Why am I experiencing that? Why do I have pain over here? And why do I have dysfunction over there? People ask those questions is because we have that habit, right? So I just tell them, hey, I have a different way of approaching. You're here to get better, all right? And if we have that approach, then we already have acupuncture points to be able to know how to treat your condition exactly according to the way we think. And that's intuitive to us. But that's not working, so we have to do something that actually works. And this is by just tapping into your body's ability to self heal by stimulating spots that do everything, because your body is supposed to do everything. At least that's the idea. And when we do that, we get maybe not everything, but we get so many benefits out of it. That's how I explain to the patients. And because it's known to be good and people are here, the patients go, okay, then do what you need to do. It doesn't hurt. Yeah, it doesn't make sense. But logically, they could follow this explanation.
I'm curious if there are other barriers to then acupuncture that you see. We had used rather you had used the example of like, okay, you're on to then think of the system as like a castle, and something that came to mind is like, okay, so if a common feature of a castle is a moat, like just preventing you from even getting to the castle. What is that, like that moat feature for acupuncture? What prevents them from getting to the castle? So if you're treating the castle, I'm talking about, okay, well, one feature is that, I've got to moat with alligators. So is that like, I don't want to be in pain, or this is too different? One thing you brought up with this, the terms that are used or the theory behind it might be foreign, or just not known.
There are different reasons why people elect to get acupuncture, not elect to. I think main reason is because the acupuncture, people don't know that it's safe, because the patients who come here tend to ask question, is acupuncture safe? But over time, more and more people are understanding that acupuncture is safe because they do their own online research or speak with people before they come. Okay, that's one reason of safety related with acupuncture. Is this compatible with the treatments that I'm getting? Things like that. Okay, and yes, it's compatible because it's working at a different layer. See, we got problem focused treatment and we have person focused treatment. Therefore, you have two distinct approaches, and there is no conflict. And besides, acupuncture does not have an adverse effect. It either works or it doesn't. It's that safe. Acupuncture is a unicorn because it does not cause adverse effect. If you say bleeding, bruise, or the discomfort, is that an adverse effect, or is it just something that's uncomfortable, but it's just not a problem over time because it heals? Even when people are taking blood thinners or those who are prone to blood, I think you call it thrombosis, the blood coagulating. Even so, acupuncture does not increase more coagulating, or it does not increase more bruise or bleeding because they're taking blood thinners. Okay, so acupuncture is that safe. It doesn't make anything worse. People don't go out with a headache, a bigger headache, where people don't go out with a bigger low back pain. Okay, so I think it's the unknown of what acupuncture is. Okay, especially using different languages, and is this like like a spiritualism, or is this like what does moving the energy mean? It's so unclear. Okay, so there's a lot of mystery in it. And so then they go to their doctor and go, should I get acupuncture? What is the doctor going to say? They have to tell the patient something because they should know everything, right? And so that's one type of a barrier that the acupuncturists need to properly convey message to the public. And so far we have not, because our language has been too poetic. Okay. Another reason is because our efficacy should be higher. It's good enough to be good, and therefore it's known to the people that acupuncture is helpful. And it's quite, anecdotal. My friend, my family. But if you knew your family for that long, your friend for that long, and that person swears acupuncture is helpful, and that is a data. That's something not something to listen in on. But overall, acupuncturists need to have a higher efficacy in treating more variety of conditions, but more number of people. Let's say out of 100 people, acupuncture is good with 30 people. That's different from acupuncture is good for 70 people. Okay? It has to meet the threshold of being, clearly acupuncture is good and it's here to stay, and I'm willing to try because there's a good possibility that I'm going to get better too. So then acupuncturists as a whole has to do a better job than they're doing now.
Well, I think that this has been a great conversation. And I think that our listeners are going to really enjoy listening to you. And hopefully they'll be more open to trying acupuncture for, their treatment management. Because, cancer is a really exhausting experience for most patients. So to know that there's something out there that can really help them, I think it's great.
Just want to thank you for being here.
Well, I thank you. I feel honored.
Thank you, Dr. Lee.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey. Thank you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media at Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website, sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.